Generally, in our late 30s, early 40s, we find out that there are things that we were used to do. We're not as good as, or we're not as capable as we used to. So I'm going to give you some of these symptoms, and you can let me know if these sound familiar. So things like having an extreme fatigue. If you work throughout the day, if you're working for somebody else, or if you're even staying at home, we have that many of us hit that 3 to 4 or 5 p.m. where we kind of hit a wall and we want to sleep, right? We've got mood swings, we've got anxiety, irritability. We talked about insomnia or lack of sleep. If you ever find yourself waking up 3 or 4 in the morning, is this psychological or is there something physiological that might be going on? Do you feel that you've got memory issues, forgetfulness, depressed mood, lack of focus, lack of drive, also known as brain fog, hot flashes, night sweats, weight gain, joint pain? One that I don't have here is some of my patients are what we call weekend wear types. They may have been athletes, college athletes. Kevin, he used to play some pro ball or semi-pro ball. That's one of the reasons. We can talk about a little about that, but how he got involved with BioTE. But workouts aren't as good as when he was in his 20s or 30s. Migraine headaches, decreased sex drive or sex performance, elevated blood pressure. And to let you know where I come from, I came from a pretty conservative, conventional training. I went to the Mayo Clinic. It's well renowned. It's great, but it's also very conservative. It's great, great training. I wouldn't question it. I truly am glad that I went there. But sometimes when you have conservative treatment, it ends up kind of treating the symptoms rather than getting to the root of the problem. And since I've been, studying and teaching hormone replacement, I realized that a lot of these things are out of balance that are causing this. So sure, you could have a treatment for every one of these things, but are you truly getting to the root of the problem? And that's what we're going to be talking about today.